Are you new to scleral lenses and having trouble putting your new contacts in? Hey, it's Dr. Pillai again from Evolution Eye Care, and scleral lenses have been such an amazing, game-changing addition to our practice. It's helped so many patients with keratoconus or refractive surgery that struggle with their vision with regular glasses or regular soft contacts, and the scleral lenses have drastically improved their quality of life by giving them improved vision and even improving their ocular surface. But when you first start to wear these lenses, some patients do struggle a little bit of putting them on because they're very different than traditional contact lenses. So some tips that have helped out a lot of my patients, especially in the beginning, is when you're filling your lenses up with saline solution, and there's lots of different preservative-free saline solutions out there, we use ScleralFil, which looks like this. And there are other ones, tangible fill, which looks like this right here. There's also Nutrifill, which is a little tricky to get right now, to be honest. But a preservative-free saline solution is what you want, and like I said, we like to use ScleralFil at our office, which again looks like this. But when you try to put the scleral lens on with the saline solution, it's pretty cold, so your natural reaction is to kind of get away from that cold solution. So I always recommend, especially in the beginning, taking that saline solution and putting it in your pocket, just against your own body heat, so that it warms up a little bit. And that will take away that reaction, and typically it's a lot easier to put the lens on when it's not such a cold saline solution. The other thing that is very helpful is utilizing a stand to insert the scleral lenses. This allows you to keep your eyelids open and have both hands free. So there are many scleral lens stands out there. We like to use the LensBase, which looks like this. It's a nice little tool where you can have your scleral lens insertion tool right into the LensBase, and it actually collects any of the extra saline that dumps out. So LensBase is really cool, helps out a lot of our patients. There's also the S5 scleral lens inserter, which looks like this. It's really cool because you can actually adjust the size of it, so a really cool device to help with scleral lens insertion. There's also the SeeGreen scleral lens inserter that is probably one of the early ones that we've worked with, and it has a nice little light source to it as well that gives you a fixation point when you're inserting your scleral lenses. So try those tips and tricks. If you're struggling putting on the scleral lenses, use a stand to help with insertion. Warm up that saline just by keeping it in your pocket, let it warm up with your natural body heat. And those things typically help out a lot of patients, especially when they're struggling in the beginning. And if we get past the insertion portion, then you can have such great vision that lasts years and years and can really improve your quality of life.